Hi, I'm Talia, a student physical therapist at the University of Central Florida, and this is Andrew, my patient, and today I'll be assessing his cervical spine. First, we're going to assess his posture. Posture is assessed in 3 views: anterior, posterior, and lateral, and it's also done barefoot with the feet shoulder width apart, standing, of course. Okay. First, in the anterior view, in the cervical area, we're going to look for lateral flexion. Andrew's pretty straight, so he's normal, but if he had a slight lateral flexion to the right, it would look something like that, but he's not like that, so he's good. Okay, turn to the side. This is the lateral view. In this view, we look for forward head posture, so we're going to look at the external auditory meatus, this hole, and then the humeral head. Andrew's is pretty in line, so he has no forward head posture, so that's good. Can you turn to the back? And just like the anterior view, in the posterior view, we also look for lateral flexion. So Andrew's pretty straight, so we're happy. Have a seat, Andrew. Now we're going to be measuring range of motion of the cervical spine. I'm going to do flexion and extension. This is done seated in a chair. The chair provides stabilization. With cervical range of motion, we can use inclinometers. Inclinometers make measuring range of motion very easy. Since we're using 2, the lower inclinometer actually allows us to account for any compensations that the patient is making with lower vertebrae. So for cervical flexion, we're going to start with putting the first inclinometer on the top of the head and then zeroing it out. The 0 needs to face the ceiling. And then the second inclinometer, we're going to put it as T1. So first we're going to find C7. Andrew, can you flex your head a little? So you're going to find the most prominent vertebrae, and then the one below that is T1. And again, we're going to 0 the inclinometer to 0, straight to the ceiling, just like that. So Andrew, can you please flex your head towards your head, flex your head please towards your body? Okay. The top number we have is 52, and the bottom number we have is 10. And when we use inclinometers, we subtract the bottom from the top. So 52 minus 10 is going to be 42. Normal flexion is 50, so he's slightly limited. Next, we're going to do extension. Again, we place it on the top of the head. And then when we do extension, we can put it on the spine of the scapula, because sometimes when we put it on the T1 vertebrae, the head hits it and it kind of limits his motion. So we're going to put it on the spine. We're going to palpate the spine. So Andrew, can you please extend your head backwards? Thank you. And we have 78, and the bottom one reads 8. So he has 70 degrees of extension, and normal is 60 degrees. So he's good. Andrew, can you please lay down on your back on the table, please? Next, we're going to be testing his muscles manually and his next. Can you just scoot down a little bit? Okay. First, we're going to be doing combined capital and cervical flexion. So for this, I'm going to stabilize his sternum. He's supine, I'm standing, and then I'm going to ask the patient to tuck his chin and then also look at the wall. If he can hold the position, it's a 3. And now I'm going to apply pressure with 2 fingers to his forehead in an arcing motion downwards. So Andrew, please don't let me move you. Hold, 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 hold. That's good. He has a 5 because he resisted against strong pressure. If he only resisted against moderate pressure, he would have received a 4. So next we're going to do sternocleidomastoid. So Andrew, he's going to remain supine, but I'm going to ask you to please put your hands above your head in the 90-90 position like this. You can kind of rest them on the table. So like this, 90 degrees and 90 degrees at the elbow. Just like that. In sternocleidomastoid, the action is ipsilateral lateral flexion and contralateral rotation. So if we're going to test the right sternocleidomastoid, we're going to laterally flex him to the right, ipsilaterally, and contralaterally rotate him to the left, and as well as flex his head. So Andrew, can you hold this position? Great, you have a 3. So then I'm going to press on his parietal portion of his head with 2 fingers in a downward motion. So please don't let me move you. Hold, 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 hold. He has a 5. Thank you. Relax. And that concludes my assessment of Andrew's cervical spine.